Hi, my name is Dave Stanton, student nurse. I have an order to give patient Skip Rocker, born 1/1/1972, 5,000 units of heparin subcutaneously every 12 hours for 3 days from Dr. I. M. Jumpy. I'll be doing this, administering this medication according to 6 rights of medication administration. I'm going to give the right medication to the right patient, the right dose, the right route, the right time, with the right documentation. Right medication to the right patient, right dose, route, time, documentation. I'm going to do some hand hygiene here. I'm going to use an antimicrobial swab and clean my work surface. I'm going to check my MAR to give heparin 5,000 units. I'm going to look at my medication here. I have heparin 10,000 units per milliliter, 2 milliliters. I'm going to have to do a dosage calculation, which I've already done. I'm going to end up giving 1 milliliter of heparin to this patient, administer 1 milliliter to this patient, which will equal 5,000 units. So I would check this against my MAR. My second check looks good. Okay, now I'm ready to need to make sure I get any medication out of the top of this, and I have ready to open my equipment, being careful not to contaminate the equipment. It's on my clean surface that I cleaned with the swab and allowed to dry. I'm going to remove my filter needle, same thing there. I'm not going to contaminate that. I will attach the filter to the needle. I'm going to use this swab package, no medication in the top. Using this to protect my hands, breaking it away from me. Got that done. Okay, I'm going to set that down. Now I'm going to use the filter needle because of the glass, being careful not to touch the sides, just in the center. And I am going to invert and withdraw 1 milliliter. And then I will return the medication. And I'm going to draw 0.2 milliliters of air. Okay, and now I need to open my needle. And I'm going to remove filter. Place the needle on. Okay. Little equipment problems. For the purpose of demonstration, I would have been able to use proper equipment, but just having to try to figure out what works here. Okay, so I've got that, the medication with that, so I'm prepared to go to the bedside. Or if I was doing this at the bedside, I would identify the patient, Skip Rocker, with his ID band, and I would have him give me his name and another piece of information, his birth date, Skip Rocker, 1/1/1972, any allergies, Celebrex, but it does not preclude the administration of this. We are going to give a subcutaneous injection. I'm going to use the abdomen. I believe I'm going to use the left side of the abdomen. I would check that to make sure that it doesn't have any scar tissue, damaged tissue, that it's appropriate, it's not been overused, he's been rotating if he's been having to take injections. I would have him in a semi-Fowler's laying back so I could get a hold of his of the subcutaneous tissue comfortably. I would explain this to the patient, explain what I'm going to do to him. I would ask the patient if he had allergies. If I hadn't already done so, I think I did. So at this point, I would be ready to glove. would take my antimicrobial swab. We've been through it today with them. So I would take my antimicrobial swab. This is going to be it. And starting in the center of my injection area, I would swab and work out. Once I had that done, I would take my syringe with air, using the medication and air. Never hurts to verify one more time. Against the MAR, medication, third check, double OK method, out. This needle is not appropriate, but I have equipment limitations, so I would use the appropriate needle, but this is what I've got that will work with the syringes in our kits. So depending on his weight for this injection, I would, well, I guess for this injection, I would, he's 185 pounds, so we're going to go at a 90-degree angle. So I would use my non-dominant hand to pinch the skin so that I make sure that I get in the subcutaneous tissue and not to the muscle underneath. And I would inject the medication and air. I would push it in, withdraw. If the sharps container was here, I would use the sharps container immediately without trying to recap. It is not, so I am going to recap for safety in my home. Grasping this down low so there are no errors. Put that in my makeshift sharps. If I needed to, I would take a gauze pad and blot the site, not to push in, but just to blot the site so that if there was any blood or anything, that could be taken care of. I would watch for reactions with my patient according to hospital policy, and do some hand hygiene. I would document the location, dose, time of the administration, and make sure the patient had the call bell, and that would conclude this administration. Thank you.